Salam and hello everyone. Welcome to or welcome back to the channel. I hope that you are all doing well. In today's video, we are going to discuss abnormal uterine bleeding, or AUB. I'm going to refer to it as AUB moving forward. Now, what I want to do in this video is I want to talk about AUB. I want to talk about some of the symptoms that occur with AUB. I'm going to talk about possible causes as well. I'm going to talk about what you should do if you believe you have AUB and how you can track yourself. I also want to talk about how this is diagnosed as well as treatment options that are available to you. Now, before we dive into defining what AUB is, we should first understand that normal menses or normal bleeding, normal uterine bleeding or period happens for a duration of 2 to 7 days at length, and then it occurs every 24 to 38 or 40 days, for example. Now, this will look different for every woman. Some women have heavier menstrual cycles, but whether it's heavy, medium, or light, it's more or less predictable every month. So you as a woman will know that you have medium periods throughout the month, some of you heavier in the beginning, and then it kind of wanes and waxes and gets lighter as as the month goes on. But what I'm trying to say is essentially you understand your body and you know how your periods look in terms of flow. With abnormal uterine bleeding, or AUB, it's a little bit different, because what we see here is we see bleeding that happens in between periods. We see bleeding that happens after intercourse. We also see bleeding that happens for greater than 8 days, which is suspect. We also see bleeding that is more or less heavy in terms of you're having to change your tampon, your pad, or your menstrual cup every hour. And then another thing is that for women who are post-menopause transition, so they've entered they've already had their menopause transition, so they haven't seen a period for over 52 weeks or 1 year, they're now suddenly seeing bleeding again, which is something of its own. It's something else that we can talk about too towards the end of the video. But that comes as a shock to women who believe that they have entered menopause and they were so close, and all of a sudden they started to bleed again. So that's what's defined as abnormal uterine bleeding, those 5 things I just mentioned. Now, in terms of the possible causes of AUB, there are multiple. One, hormonal balance. Hormonal fluctuations happen with our estrogen and our progesterones. So it's one of the reasons is that we have a fluctuation in estrogen and progesterone. And so that's something that we need to look into in terms of what's really behind abnormal uterine bleeding. Another thing we need to look at is, and I've talked about this on my channel before, is fibroids and polyps. Sometimes fibroids and polyps are a cause for excessive bleeding, and that's something we also need to look into. You have to be able to understand how fibroids affect the body. Another thing that happens is some medications cause excessive bleeding, blood thinners, for example, or even some combined oral contraceptives, or some combined contraceptives, I should say. There have been thoughts that thyroid medication or thyroid issues can cause excessive abnormal uterine bleeding, as well as infection, and even pregnancy can be a reason for abnormal uterine bleeding. Now, the way in which I just wrapped up the causes is usually, spoken to non-clinicians. However, clinicians like to refer to, or I should say clinicians usually refer to characteristic strategies called the Palm-Cohen clinical classification. Now, this clinical classification I will list for you on the screen now, but I will read it off because I pulled this from the Menopause Society Clinical Practice Guidelines. And PALM refers to the structural causes for abnormal uterine bleeding, and they include P for polyps, A for adenomyosis, L for leiomyomas, which are fibroids, as well as malignancy and hyperplasia. Now, for the non-structural causes for abnormal bleeding, that's Cohen, or Coin, depending on who you speak to. C for coagulopathy, O for ovulatory dysfunction, E for endometrial, I for iatrogenic, and N for not yet classified. So I'll go ahead and post that for you so that you can get an understanding. But just know that that's what clinicians usually use in terms of characteristics and diagnosis of the structural and non-structural, features of abnormal uterine bleeding. Now let's talk about what you should do if you're having excessive bleeding. Bleeding that is not normal. It's really something that doesn't look normal and hasn't looked normal in a while for you. One of the things I would say is to start tracking the number of days you've had your period, as well as the start date, the stop date, and then also be sure to document how many pads you're using, how many tampons you're using, how many times you are emptying your menstrual cup. These are things that are important because a lot of providers are going to be asking these questions. How many times have you changed your tampon? You don't want them to dismiss you, which has happened, unfortunately, in many cases. So by you keeping a track and a personal diary of everything that's going on, that just helps you when you go to state your case for, okay, this is what's going on. This is not normal for me and I need help. Another thing that is also important for you is to document pain. If your pain, there's usually a pain scale, 0 to 10, document the pain. Do your best to determine if your pain during your menstrual cycle or outside of your menstrual cycle is excessive and it's high. Document that. Don't be shy about, documenting and advocating for yourself and if you're feeling a lot of pain during these cycles. Now, another thing that I want to talk about is how is AUB diagnosed? Clinicians will usually use a pelvic exam to diagnose AUB. There is also ultrasound, biopsy, as well as certain blood tests. Now, providers, it's going to be provider dependent. Your provider may or may not call or order up lab tests, so it's going to be up to them. And some like to look for markers of anemia, for example. Okay, if she's bleeding a lot, then maybe she will show anemia. Again, that's provider specific, but there are other ways to diagnose AUB. And one thing I also wanted to mention is diagnosis is age and symptom related, so keep that in mind. So let's dive into the current treatment options that are available for AUB. Now, I looked at the Menopause Society clinical practice guidelines for this information, and although they talk about treating women who are in the menopause state of life, it's really important to know that AUB is often seen in perimenopausal and postmenopausal women. So what I've noticed is that clinicians will push for prescribing progestin to treat AUB, and that's because it helps to thin out the uterine lining. Now, other birth control options are available, and I have seen or noted clinicians like medical doctors and nurses to have prescribed that to patients who are experiencing AUB. Now, there are other prescriptions available and over-the-counter agents available. So iron is used to treat the anemia, for example, but also know that when trying to shrink fibroids or shrink something that might be causing the bleeding, for example, I would say that, well, let me correct myself. To shrink the fibroid that might be a cause of the AUB, I've noticed that vitamin D has been an option, which I spoke about in this video here, as well as EGCG. And I also spoke about this a couple of times on my channel. So I've noticed that vitamin D and EGCG has been used to shrink fibroids. One thing that I would say is it's provider specific. It's to the provider's knowledge and I would say clinical practice and how they've been doing it for years. I know that the Menopause Society is they have experts that give their opinion on what to use and how to treat, and a lot of people do abide by those. They take the expert opinion very seriously, but I know that some clinicians also like to treat their patients on their own. So it's going to be up to you and your provider to work that out to get the best possible treatment for yourself. Now, I want to say that it is important to really track your symptoms and know when too much blood loss is occurring, because if you feel dizzy, if you feel faint, if you are, having issues with fatigue and really overall well-being, it's going to be important for you to really get help, seek help, and don't delay. I want you to take care of yourselves, but it's going to be important for you to keep that diary and advocate for yourself and push so that you aren't dismissed, in the healthcare setting, which happens a lot with women of any age. We are often dismissed, and our signs and symptoms, or I should say our symptoms, are not taken seriously. So I want to know from you, are you experiencing AUB? What have you done about it? If you're too shy to share that information, that's not a problem. It is personal. AUB is not a light topic, I should say, but I do hope that if you are having AUB or symptoms of AUB, that you are getting the help you need, and I am pushing for you, and I'm hoping and advocating that you get all the best care in the world that you need. So I do thank you for watching, and I shall see you in the next video. Take care. Bye.